things. I've been a physical therapist for 20 years, in private practice for a little bit over 2, partnered up with Amy to share this amazing office space late last year. I work with all things orthopedic, so bones and joints and sprains and strains and pre-surgery and post-surgery and all that kind of good stuff. So I always say, if you've got bring your aches and pains and strains and sprains my way. So that's what I do.
Awesome. And if Amy, you'd like to?
Yep, and this is Amy, Dr. Amy Camillo.
Oh, thank you. So Jesse and I worked together for many years before this, and we've been together a little over a year now, but in this space since November. I do pelvic health physical therapy, so basically belly button down to mid shins is where I live. Everything else I would send Jesse's way, but really helping men, women, and children with anything pelvic health related. Most people don't know what that is. I'm happy to answer questions. If people want more information, if you're my husband, you ask me to change the subject often. Clients would be like great referrals would be pre and postpartum, so pregnancy, postpartum. So if anyone's having diastasis rectus with their pregnancy, pelvic pain after, urinary incontinence, constipation. My daughter refers to me as the poop doctor all the time. But I do a lot of other things. So people with hip issues also can have pelvic floor issues, tailbone pain. I see a lot of people with just like chronic pelvic pain, things that maybe start in their abdomen, refer down to pelvic floor. And 2020 has been a big year of tailbone pain, right? We're sitting at home working and not in our normal desks, and then just everyone's having a lot of tension. So something people don't know is if there's like migraines and maybe TMJ disorder, a lot of times there's pelvic pain that goes along with it. So that's really where I live, places we didn't even know there were muscles. So I should have brought my model out here. But like I said, I'll give more information as people want. So I have a lot of patients who are able to get great reimbursement. It just depends on their insurance plans. I'd say Blue Cross Blue Shield's probably been the best. But it just depends, on their out-of-network coverage and benefits, and the same for Jesse.
Yeah,
right?
so we're both out-of-network, which has been what provides us to be able to spend as much one-on-one time with our patients. So, all of our appointments are just with us. We don't have any aides or techs that work with us, and they're all, an extended period of time compared to what you might experience with a big box PT.
Nice.
So
And
at
well
least an
worth it.
hour.
Yeah, at least an hour.
What's that?
And well worth it.
Yeah.